go and see a counsellor, and whether or not it's the fact that your doctor's referred you for counselling, or you've gone privately, and you feel you're just not gelling with that person, should you maybe think about changing?
Absolutely. It's really, it's really important that you're comfortable with your therapist. Sometimes you might see 3 or 4 therapists before you actually find the therapist that you feel comfortable talking with.
Yes.
And it's really important that you don't sort of try and make it work. You'll know when you've met the therapist who you feel comfortable talking with and exploring your life with. You'll know. You'll know
because you'll know if you want to see them again, won't you? As much as anything
Absolutely.
else. Yes.
And never be afraid of saying to your therapist, I'm really sorry, I'm just not getting what I want here.
If somebody is sent if they're referred through the NHS then, and they want to change, is that usually possible within the NHS, or is that could be tricky, I guess, due to resources?
Due to resources, it can be very difficult. It is possible but very unusual for that to happen. You tend to be allocated, you don't get choice. You're allocated to a counsellor who covers your area. And so there is less choice. The thing with going privately is you've got choice of therapist, but you've also got choice of how they work.
What if you can't afford to go privately though?
There are affordable counselling services out there. If you Google or Bing or any of the search engines, not to be biased towards one in particular one, but if you actually search for affordable counselling and you put your nearest town, you'll normally find affordable services. But beware, some affordable services are still saying they charge £25 an hour. Truly affordable services will take into account how much you can earn, how much you can pay in relation to how much you earn, and will have a structure in place that can try and help you to find therapy even if you can't afford the full price. The other thing you can do is if you see a therapist that you feel you could work with and something about what you're reading on their profile resonates with you and their fees are expensive, pick up the phone, give them a ring, tell them what your situation is, tell them what you can afford, and ask them if they could see you for that. Negotiate in a way, because if the therapist can, they will offer a reduced fee. So you've got 2 options. There's organisations that offer affordable counselling, and then just phone a therapist, ask them.
So it's really encouraging, and it's showing that there is actually help and support out there for everybody.
Yes.
It's perfectly possible for everybody to access counselling one way or another. It just might take a little bit of legwork to find the right person for you and to be able to get somebody who you can afford to pay for.
On the whole, therapists don't train to be therapists because they want to make lots of money.
No.
There isn't lots of money. It's about care. It's about wanting to make a difference.
For anybody who has never been to a counsellor, what might they expect to happen, say on a first session, just to give an idea? Because I think some people are quite worried about actually having to go for anything that they would term as therapy at all, aren't they?
Yes. And I think there is something about when you go for your first session, you may be asked, you will be asked your name, you may be asked to give your address, confirm your contact details, telephone numbers, if it's okay to leave a message on those. If you give a telephone number, is it okay to leave a message? It's all about your confidentiality, your date of birth. You may be asked your doctor's name and address. It's not because the counsellor will write to the GP, but it's important the counsellor has those details for if there was an emergency, the counsellor knows who to contact. So, if you go privately for therapy, none of what you say gets sent back to your GP.
That's very important for people to know, I think.
Absolutely. It stays between you and your therapist. And it's not open for anybody else to actually be told.
No.
The other important thing is you will be told about confidentiality. Now this is very important because there are certain things that some therapists would break confidentiality for that others wouldn't.